My name is Dr. Colin MacLeod. I'm a naturopathic doctor. Here today to talk to you about cancer, and I'll touch on pancreatic cancer a little bit. So a little history about me. I was born in Cape Breton, and I grew up in Cape Breton, and I went to St. Mary's University in Halifax. And after that, I went to the Canadian College of Naturopathic Medicine in Toronto, which was an additional 4 years. Now I'm seeing patients at Alternate Chiropractic. It's a multidisciplinary clinic in Dartmouth. And you might be wondering, what is naturopathic medicine? So naturopathic medicine is a system of medicine that emphasizes careful investigation and in-depth evaluation and gentle yet effective treatment, and care is taken not to treat too aggressively as to overwhelm the patient and impede their vitality, but to treat in such a way to encourage long-term healing and wellness. Time is taken to take a patient's case fully, arrive at a proper diagnosis, and implement treatment and follow-up on this treatment. And some reasons that people usually come to see a naturopath is they may be interested in natural therapies. They may have heard from a friend that a naturopathic doctor helped them somehow. Very often it seems to be the case that patients may be fed up with shorter doctor appointments or drug-based treatments, and they come to us for some more natural alternatives. And some people feel like they've exhausted all their options and this is their last resort, so that's why they come see us. Good news is we're here to help, and some of our treatments are quite effective. So what we do, these are some of the things that I'll use in just general practice from day to day. I work a lot with nutrition, lifestyle changes. That's kind of the cornerstone of practice. I work quite a bit with herbal medicine as well, Chinese medicine, physical therapies, and cancer treatments. We do offer some cancer treatments. And how we are different from medical doctors. So naturopathic doctors aim to identify and treat the root cause of illness, whereas sometimes medical doctors aim to control symptoms. And naturopaths spend 60 minutes per initial appointment with patients and 30 minutes per follow-up. And on average, medical doctors are closer to 5–10 minutes. And naturopathic treatment is individualized and utilizes a variety of medicine types, while conventional medical treatment is generally drug and surgery based. Not that it's necessarily a bad thing, but that's kind of how it is. And cancer. So cancer is the #2 cause of death in Canada, killing about a quarter of the population. It's a pretty staggering statistic, is that 1 in every 2 men and 1 in every 3 men will develop cancer in their lifetime, although not all will die from it. Cancer diagnoses are expected to go up by 45% in the next 20 years, from 1.6 million to 2.3 million in 2030. And cancer is essentially uncontrolled division of our own cells, which have lost their ability to control themselves. I'm sure a lot of you guys know quite a bit about cancer already. I'll just kind of touch on some of the physiology. These abnormal cells are actually very common. In fact, everybody has a tiny amount of these abnormal cells in their body, but your immune system helps to keep them in check. And they never get a chance to gain a foothold. In the DNA of every cell, there's a message to stop replicating. This message is deactivated when this message is activated when the cell gets to the end of its lifetime. And in cancer cells, this gene is permanently deactivated. There are a number of genetic mutations which have classically been blamed for a lot of cancers. However, true genetic mutations only account for about 5–10% of cancers. So how does cancer develop? So the answer is altered function of genetics. Essentially, a gene is a section of DNA which functions from within a dynamic molecular soup. This soup can alter the function of the genes within it. A few key factors alter genetic activation. Inflammation is the most powerful gene activating factor, and deactivating factor for that matter. Inflammation has the power to turn on and off turn on and off different genes, we measure inflammation with standard markers of inflammation like interleukin-6 or C-reactive protein. There have been studies done which link higher levels of both of these markers to increased likelihood of developing or worsening of already present cancer. So here's a study looked at women with metastatic breast cancer, and it found the higher their blood levels of interleukin-6, the faster their cancer worsened, and the patients died. So as you can see here on this slide, the line at the top is the line down here is the higher amount of interleukin-6, and the higher it is, the shorter the survival time was, and the lower it was, the longer the survival time was. It's kind of significant. So someone's wondering if interleukin-6 testing is common in cancer, and it's not a very commonly used test, actually. So this is kind of a new thing. It's kind of interesting. And here's another study also with C-reactive protein and C. This was another observational study like the last one. It looked at levels of C-reactive protein, and remember that it's another marker of inflammation. So this is a similar type of thing. The higher the CRP, the quicker or the less survival there was. So people died quicker when the CRP was higher, and the lower the CRP was, the longer people lived. Those two are generalized inflammation markers, yes. So yes, in these two cases, the higher levels of inflammation strongly correlated to the worse progression of the cancer. And so I suggest reducing inflammation by doing things like improving diet, exercising, and sleeping, and talk to your naturopath about specific treatments. There was a paper titled Diet and Cancer published by a Harvard oncologist, and he stated that cancer deaths were linked to improper diet in about 35% of cases. Dietary factors connected to cancer include excess calorie consumption, excess animal fat consumption, reduced fruit and vegetable consumption, and low dietary fiber. But does a healthy diet really make a difference? So here's a small study of 24 patients with advanced lung cancer. Those who ate 1 cup of vegetable soup every day had an average survival time of 15.5 months, and those who didn't had 4.5 months survival time. So that's 340% increase in survival time from vegetable soup. It's pretty interesting stuff. And here is another study, and this one is in bladder cancer. And patients who ate 1 cup of raw broccoli per month, that's only 1 per month, reduced risk of dying by 57% over an 8-year period. So again, that's pretty huge. That's a pretty good reason to eat 1 cup of broccoli a month, I would say, if not more. And this one is also pretty interesting. So it's a fairly large study, almost 1,000 women. It found that women who increase their exercise level after diagnosis of breast cancer are 50% more likely to have a better prognosis and survive their cancer. Women who decrease their activity level significantly after being diagnosed were 400% more likely to not survive compared to the women who kept their activity level the same. So that's pretty huge. So there's some specific treatments that naturopaths use in cancer, different types of cancer. And as far as they are Viscum album, that's mistletoe injections, and intravenous vitamin C. Someone was wondering about intravenous vitamin C and just what a medical professional might react, how they might react to that. So it is a pretty hot button issue, and there has been quite a bit of research done on it, and some of the studies have been discredited or just criticized. So not all of them. You know, you can't really look at every single study that's been done and trust it, but some of them have been good, some of them have not been so good. So I kind of see where they're coming from, you know, to some degree. There's been quite a few studies with showing safety. I haven't talked too much about safety in this presentation of intravenous vitamin C, that is. Someone was wondering about how if high doses can be detrimental. I don't have too much on that here, but there is quite a bit showing that it's pretty safe, actually. There's been some studies in the past 2 years that have showed it's pretty safe stuff. So first I'll talk about Mistletoe, so that's Viscum album. So Viscum album, commonly known as Mistletoe, it's a herbal extract used in cancer treatment by naturopathic doctors. It is injected subcutaneously, that is under the skin, around the area of solid tumors. Side effects are generally minor and usually consist of inflammation and mild pain around the injection site. Many studies have found it to prolong survival, control symptoms, and improve quality of life. So here's a review of 41 studies which used Viscum album for cancer. Found reduction in mortality rates compared to those not given Viscum. This is a pretty big deal for herbal medicine with not much side effects to have such a strong impact. There's viscotoxins, is what they call it. It's the constituent in Viscum, and that's believed to be the constituent that leads to the cytotoxic effect on cancer cells. So this vertical line here is essentially the non-treatment with Viscum in all of these trials. This is the review of 41 studies that I mentioned here. So the straight line is kind of the control group, so the group that wasn't given the Mistletoe. And then all these other horizontal lines are the groups which were given the Mistletoe. And at the bottom of the graph, it's the hazard ratio, and anything to the farther to the left is a lower hazard ratio. This is essentially showing increased survival times in all of these ones that are further left. So there is actually 2 studies which show worse survival time. There is one, there's another one here down here, 2 that show about the same survival time, and the other 37 show increased survival time. So that's pretty significant stuff. That's all cancers, yeah. That's general cancers. This paper reviewed 25 studies on Viscum treatment and quality of life, and it found that the vast majority of the studies found a benefit from regular treatment plus the Viscum compared to regular treatment alone. Improvements were seen in many measures, including energy, digestive concerns, ability to work, and general well-being. The way that generally you do it is it's around the tumor. So if there's a solid tumor, then it's injected near the area. So it's not, you don't have to go like right on top of it. It's not like you have to put it right next to it, but it's like, you know, you wouldn't put it in your chest, or, you know, you put it as close as possible. Subcutaneously into the fat, yeah, that's how Viscum is injected. Sometimes an oncologist doesn't really want to support this type of treatment, and it's the patient's choice from then on. Research so far, all this research is done concurrently with standard treatment, so it's kind of showing that it works with it. And yeah, I very much encourage you to check these studies out, you know, for your own interest. Don't go just on what I'm saying. Definitely don't. Mainstream medical, yeah, like this one is Integrative Cancer Therapeutics, mainstream study. There's the BMC cancer, that's also very mainstream. Yeah, all these are pretty mainstream. So here's a Viscum in pancreatic cancer. This is a human study, actually, so you guys might be interested in this. So it's 400 pancreatic cancer patients given regular treatment with Viscum or regular treatment alone, and overall survival is 48% higher in the group given Viscum compared to those not given Viscum. And adverse reactions to general treatment were much less in those treated with Viscum. So there's a graph of survival here. It's not by any means a cure. I mean, it's not even close to that. But the green line is those treated with Viscum, and on the bottom, this is months, it's time, and on the left-hand side up, that's percentage of people surviving. So the green line is people treated with Viscum, and you can see that more of them survive longer, essentially. And as I mentioned, the side effects were less as well. I think I have a slide on that. Yeah, so this is the same study, side effects. So the Iscador, the Viscum group on the side, has about 15% of the people have side effects, And here on just the regular without viscum group, about 50% of people do, so that's pretty. This is a graph of adverse drug reactions to the conventional treatment. So it's not reaction to the viscum, it's a reaction to the conventional treatment. And it's in those receiving viscum, sorry, wrong slide. Right, those treated viscum represented by the vertical lines, and the red line is kind of like the equivalence. That's where just standard treatment alone is represented. So anywhere below is essentially less of this specific side effect. And as you can see here, here's irritability, for example, and that one is less. Vertigo is the lowest one of all, actually. The one that's actually more is tumor pain, because in the area you can get some pain when you give the viscum injection. All the other ones are actually lower, so it's pretty significant. Standard treatment, 2 to 3 injections per week, and yes, I provided my office. And it goes through the length of the conventional treatment, as was asked by somebody else. The pain is very intense with the injection, so it's kind of like a trade-off. You have a little bit more pain, and then the rest of your symptoms are brought down. It doesn't conflict with the treatment used in this study. I can't really speak to the other treatments, but the treatment used in this study. Yes, so that is a really good point, actually. So it has been studied, viscum has been studied in gemcitabine, and it seems to be safe along as a treatment with that. So I'm going to switch. I'm going to start talking a bit about intravenous vitamin C. So this is the molecule here down far right-hand corner. That's vitamin C. That's glucose beside it. Very similar shaped molecules. So intravenous vitamin C is high doses of vitamin C delivered directly into the bloodstream through the vein. The blood concentration of vitamin C achieved through intravenous treatment is much higher than can be reached with oral treatment. Vitamin C in cancer is an old concept. The first research was in mice in the 30s, and then the first reported trial in humans was in the 70s. There's a human study here. It's a really high quality study, quite well performed. There was 3 cases of advanced cancers: kidney, bladder, and lymphoma. And they had unexpectedly long survival times. Here is a X-ray from one of the patients, and this just shows quite a few different lesions, cancerous lesions in the chest. And this is 1 month after starting the intravenous vitamin C treatment. And here is 7 months later. Essentially, all the lesions are gone. There was nothing to compare to in this study, so there was no similarly matched person who didn't receive vitamin C. So it was hard to tell. You know, it's kind of a starting point, really. It's not necessarily saying give vitamin C to everyone now, but it's kind of it's definitely pretty interesting. I think in this study it was terminal. They were all terminal cases, so the treatment was stopped. The conventional treatment, that is. So here is a study of here is 39 terminal cancer patients. They each received 10 grams of intravenous vitamin C 2 times over the course of 3 days. And quality of life was measured using a standardized questionnaire. And you can see there was pretty drastic change in quality of life measures for almost everything. There was 2 down at the bottom, just constipation and diarrhea, which didn't really change. But other than that, all these measures significantly changed. And this p-value here, some of you may be familiar with, is just how significant the findings are. And below 0.05 is considered significant, or sorry, lower than that. So all these are considered significant findings. Actually, this one is just borderline, but this one as well. So it didn't notice a change. It wasn't looking for a change in survival. It didn't really report on that. I don't think they even treated that long. I think it was just they treated for 3 days and then they measured a week later, and this is what they found. So essentially improved quality of life. This one's interesting too. Again, survival wasn't studied. It wasn't looked at. But so stage 4 pancreatic cancer patients who were not eligible for surgery had not yet begun treatment. They were treated with intravenous vitamin C 3 times a week for 8 weeks, in addition to standard gemcitabine treatment. And tumor size was measured by CT scan. This is tumor size in all the patients. So in one patient it remained the same, in this one here, and in every other patient the tumor size decreased. So that's, again, the survival wasn't measured, but again, it's pretty interesting stuff. The tumors actually decreased in all those patients. So the question is IV vitamin C absorbed better or more? And yes, this slide kind of shows that the green box with the arrow points down to the bottom, and that's how much vitamin C will absorb if you take it orally at maximum doses. And these bars are the amount of vitamin C you absorb, or these patients absorbed in that study when they were given intravenous vitamin C. So it's magnitudes of difference. It's a massive difference. It's not even comparable, really. It's hundreds to 1,000 times more. And there's also a study that looked at the mechanism of action. So cancer cells were grown in a lab and exposed to vitamin C. Yes. And it killed the cancer cells powerfully, and it did not hurt the normal pancreatic cells. So they had both in the dishes, or in each dish they had normal cells and cancerous cells, and they exposed it to vitamin C concentrations which were similar to this, on the much higher than what the oral dose would give. And these were the results. So this one, H6C7, is the normal pancreatic cell, and it's fine. It's survived, no problem. This is with addition of the high dose vitamin C. And these 3 are cancerous pancreatic cells, and they all came right down. So this is 0, so no vitamin C, black. This is 5 millimolar, so that's just it's concentration. It's fairly high. You wouldn't be able to get that with oral dosing. And that's this white bar here. And this one is 10 millimolar, which is just a bit, is more. So you can see normal pancreatic cells not hurt, and then these ones are pretty actively destroyed. And here's one of the cancer cell types. There's just a few different cell types here. The first 3 are all different types. And here you can see with increasing concentrations, the amount of cells just gets lower and is gone by 20. This is all in vitro. It's kind of a hot topic. There was some research done in the early 70s on vitamin C high dose, and it showed the survival was quite a bit better in many different types of cancer. And then that specific research was discredited or criticized for a few different reasons. And then since then, there was a Mayo Clinic. I don't know if you guys are familiar with their studies. They did 2 or 3 actually on oral vitamin C, and they said it didn't work, so vitamin C doesn't work. But it's not testing the same thing. It's not testing the intravenous, so it's a different measure. It's a different measure. And this is just that second type of cancer. So sorry, that's the second one. So it also went down with higher concentrations. And then next, they introduced catalase, and catalase So first is the cancer cells, just with nothing added. The second one is with the vitamin C added, that's ascorbate, and the cancer cells are pretty powerfully killed. And in every one, or in the next one, they add catalase, which is just an enzyme, which can prevent vitamin C from oxidizing a cell, from breaking it down. And then in the next one, they add catalase plus ascorbate. So essentially, in this one, here's the cancer cells. And in this one, they add vitamin C, kills the cells. This one, nothing happens when they add the enzyme. This one, vitamin C plus the enzyme, again, nothing happens. So catalase blocks the action of vitamin C. I mean, at least it shows here in test tube. And that's kind of the reaction they believe is responsible for vitamin C killing cancer cell, theoretically, in humans. So here's the example, or a diagram of that. So vitamin C enters a normal cell, and vitamin C releases hydrogen peroxide. Catalase breaks down the hydrogen peroxide into water, CO2, nothing, no problem. And then vitamin C in the cancer cell goes in. It's kind of thought that it doesn't have the catalase, so hydrogen peroxide builds up and kills the cell. So in order to kill the cancer cell, vitamin C needs to be high. Oral vitamin C won't work, can't get enough through oral supplementation. Needs to be introduced directly into the bloodstream through an IV. And that same study, so I was just talking about, they took mice and they took those same pancreatic cancer cells that they were growing, and they put them into the mice. And here is a graph of the tumor size of the mice. So it's essentially they matched. They had the mice divide them in half, and half of them received sodium chloride, so just salt solution, and a similar concentrated ascorbate solution, so vitamin C. In the salt group, so they were just given salt water intravenously. Tumor grew quite a bit, and just over time, over the course of 21 days, it grew this much, this many millimeters, so about 450. And then the ascorbate given mice, it only went up to about 100 or so in 21 days. That's pretty significant. And then there's survival in the mice. The ascorbate's the black, so it came down, and they eventually, most of them were dying, but it was slower than those that were given sodium chloride, so they just lasted longer. So that's basically the talk. So summary: eat lots of fruit and vegetables based on that. The studies I was talking about on the fruit or the vegetable intake and improved survival, and exercise as well. If exercise as much as you can when you can, and make sure to get enough sleep. Talk to your naturopath about reducing inflammation, and consider Viscum and vitamin C treatments. Sure, yeah, I mean, these things can't really be patented, and that could have something to do with why research isn't funded as much, because it would be nice to see more research. You know, there's been some interesting preliminary results, and it's kind of my stance on it is I've seen it work. I've seen a lot of naturopaths do it. I haven't used it much myself, to tell the truth, but I've seen it work. I've seen quite a few naturopaths use it, and to pretty good result. I've talked to the patients, read the pathology reports, seen, you know, tumors shrinking, grades kind of improving. So that's kind of why I'm talking about it, although the research isn't there. It's more of an experience thing. And at my school, it was used. There's a cancer shift, and they see a lot of patients for cancer, and they use it there. And there's good results. I mean, you can't expect cures in everyone, or in, you know, even a majority of people, but in Ontario, my school did work with some oncologists. There was a few, I would say it's a minimum, who actually would work with them, but a few, yeah, I would work with them.